pour cette conférence qui va être faite sur la situation des handicapés dans le monde. J'ai le plaisir d'introduire M. Francis Ayomoh de Missing Billion, qui va nous faire la conférence. Donc, I want to introduce our guest, our honorary guest, Francis Ayomoh, who's going to give us a very nice speech on that topic, which is very important. You have the floor.
So I have a huge job today, which is to give you a brief overview of the situation of health for persons with disabilities across the world. Now, that's a huge task to deliver in a few minutes, especially since I'm looking very broadly and not just on the situation with intellectual disabilities alone. But to begin, I'd like to talk about our organization, the Missing Billions Initiative. But first, to introduce myself, I'm Dr. Francis Ayomoh. I'm a senior research fellow with the Missing Billions Initiative and a doctoral candidate in primary healthcare at the University of Oxford. And I'm sure you'll be wondering, who are the Missing Billions Initiative? We're a research group and a think tank based in the United Kingdom, but operating in several countries around the world, mainly to promote research, data generation, and advocacy for the health of persons with disabilities. And some of our visions include to see that across the world, all persons with disabilities have access to healthcare and can live healthy and independent lives. Our mission is to mainly see that health systems transform to make healthcare accessible for persons with disabilities, regardless of the type of disability they have, whether it's mental disability, intellectual disability, or physical, as the case may be. And then, of course, to see that we galvanize efforts of the government, development partners, and other stakeholders. So to start, I would want to tell us that there are 16% of the world's population today are living with one form of disability or the other. Now, that's a huge number. That's at least 1 billion people, which is where my organization derives their name from, the Missing Billion Initiative. And these people mainly have problems with healthcare because they have some form of disability, they are different, and their unique healthcare needs make them have even greater needs for healthcare services. But unfortunately, these people who have greater needs for healthcare now face more difficulty in accessing healthcare. And studies that we have conducted have shown that persons with disabilities face worse health outcomes. So if you look at some of the common tracer conditions that we referenced, they are 3 times more likely to have diabetes. As children, they are 2 times more likely to be malnourished. When it comes to accessing healthcare, they are 50% more likely to have challenges in paying for healthcare. That's a catastrophic health expenditure. They have a 2 times more likelihood of having HIV/AIDS and 10 times risk. There are pediatricians in the room, so I'm sure they'll agree with me that they have 10 times more risk of getting severely ill, either due to neglect or due to difficulty in understanding their issues. And then lastly, because of all these put together, in most countries, the life expectancy for persons with disabilities is lower. Now, I think you assume that what I'm describing is something that's relevant to Senegal or to Africa or maybe developing countries. But interestingly, these findings reflect across the world, both in the high-income and the low-income countries. If you look at the map that's on the screen now, you see that across the world, persons with disabilities have lower life expectancy. That means they are likely to die at a younger age because of these healthcare challenges they face. And looking at the map, you see that in Canada, they have lower life expectancy by as low as 8 to 12 years. In the UK, same figure. In Sweden, about the same figure. If you come down to sub-Saharan Africa or the developed world, the figure increases in the gap. We see that in Egypt, it's about 8 to 13 years. They'll die earlier by 8 to 13 years. In Kenya, 13 to 16 years. In India, as high as 10 to 17 years. And in Indonesia, 9 to 15 years, among others. Now, this is quite unfair because we are all supposed to live, we are all supposed to have the right to health and all have equal opportunities to reach our full potential in life. Studies by the Missing Billion Initiative also show that the problem with disabilities, though affecting all persons with disabilities, but these challenges are even higher in people who we classify as marginalized groups. So those who are disabled and poor have a 24% likelihood of having issues with their health. Women have a 19% chance of having disability compared to men. Then people who are age 60 and above across the world, at least half of them have one form of disability or the other. And then also, as we can see, there are a lot of wars and crises across the world, creating a lot of refugees and internally displaced persons. These persons have a 2-time likelihood of having one form of disability or the other. And we saw that there's a bidirectional relationship between disability, poverty, and the vulnerability to ill health. So in some case, your problem might start with a disability, which might maybe affect your ability to get income, and then you end in poverty, and poverty will lead you to ill health. Sometimes it might be poverty that leads you to ill health. You may not be able to seek care, and you end up with disability. So there's some sort of circle that we need to break, which is one of the messages that we at the Missing Billions are passing. And the problem with disability is multi-level, which is why whatever we are doing today or discussing in our approach to help persons with intellectual disability, we have to take a multi-sectoral approach and have a broad health system approach in addressing these issues. What are the problems around governance of the health system, the leadership, health financing for persons with disabilities, data and governance? Do we really have data? Is there adequate research on the population of persons with disabilities, their categorization into different groups, their particular needs? And then when it comes to the issue of service delivery, how aware of their healthcare needs are persons with disability, and how affordable is this healthcare? I was impressed to hear that there's effort in Senegal to provide free services, both from the side of the government, and also that the Special Olympics Senegal has some efforts to see that they give free medical services to and screening for persons with disability. Please, let's give them a round of applause for that. So other problems that we have seen, which are very key to disability, and I think my colleagues in the health sector will agree with me, is the issue of human resources. Do we have enough health workers, doctors, nurses, community health workers that understand the needs of persons with disabilities? Do they have the right equipment to help them? And do they have the right training to be able to engage with persons with disabilities? So while we try to talk about disability broadly, or about disability linked to persons with intellectual disability, we need to have this broad approach, because it's when we address all these areas that we're going to see improved outcomes, which will be better and equal access to healthcare for all persons, including persons with disabilities. So the question is, having talked about this, what should be the priorities for change? We at the Missing Billions recommend some key starting points. First, autonomy. Persons with disabilities should be aware of their healthcare needs, know they have a right to healthcare, and be able to get this healthcare where they need it. Affordability. Where possible, services for persons with disabilities should be free. Otherwise, they should be significantly subsidized, not according to their ability to pay, but according to their need. Then another priority should be human resources. With healthcare, no matter how much we advance AI or advanced technology, there's a limit to which these things stop, and you must have a healthcare worker to deliver one service or the other. So we need to prioritize the human resources available to deliver services for persons with disabilities, to see that they have the right training, they have the right skills, and they understand the unique needs of persons with disability. And then lastly, our healthcare facilities. While I know that in many countries we send community workers to go to persons with disabilities and other people in their communities, we cannot overemphasize the need for our healthcare facilities to be inclusive. How many healthcare facilities have ramps for persons with disabilities to be able to push wheelchairs up? How many healthcare facilities have signs that people who have hearing impairments can be able to read, or have an interpreter on ground for people that have those kind of needs? So we need to structure our healthcare facilities to meet the needs of persons with disability. And then looking at the system pillar level, some of the key areas that we have identified are the issue of governance and leadership, very key. If the government does not take a lead in providing support for persons with disabilities, there's only a little that can be achieved by organizations like Special Olympics, because when the government is included and takes some of these things as a priority, then there's going to be scale, we're going to reach more people, and in fact, the right laws and regulations will be put in place to see that persons with disabilities are not left behind. Another key area that we emphasize on is the area of health financing. I'm happy today to hear that we have UNICEF in the room and some other stakeholders that are supporting this event. It is very important that we have the right funding, both from government and from external sources, to support interventions and programs for persons with disabilities, because many of these people, like we saw in my presentation earlier, are poor, they are already at a social disadvantage economically. So there needs to be adequate funding for such people so that they are not left behind. Because if we allow them to struggle for services and pay for them like other people, then you already know that they won't have the healthcare that they require. Finally, a very important point, which at the Missing Billion Initiative we are championing, is the need for data and evidence. Because in many countries, if you ask the Ministry of Health or the Ministry of Social Welfare, how many persons with disabilities do you have in the country? They don't know. How many children were born with disability last year? They don't know. So once we don't have that data, it is not difficult to plan for persons with disabilities that are on ground or those that provide for their unique needs. So one key area that we propose is that there should be enough effort to address these needs, these data and evidence needs, which is why at the Missing Billion Initiative, we've created some toolkits which we're recommending for countries to use to assess, especially for countries that may have not done any assessment, to do some sort of baseline assessment of where is the health system in disability at the moment, where are our facilities, how are healthcare workers delivering services. Because if you have that baseline, then that starts your journey of, okay, now we know that we are 50% of what is recommended. How do we make progress to meet our target? We recommend 4 dimensions to the solution. First, we recommend that countries should measure and improve. So just like I was saying, using the right assessment toolkits, of which the Missing Billion have developed, something that countries can consider, see how well we are performing, get the right advice to the Ministry of Health and relevant ministries of social welfare, education, and the like, and then also have some sort of dashboard or screens that we can use to monitor what is happening within disability in the country. The next is to inform and influence. Like mentioned, financing is very key to promoting disability inclusion in health. So it is important that we engage relevant stakeholders and advocate for more resources, both domestically and externally, to promote welfare for the persons with disabilities. The next is innovate and test. I'm amazed by the work that Missing Billions Initiative is doing, especially hearing Raja talk about the community outreach where they're educating people about health and the free healthcare. Not every country is doing this, and it is important that as we identify our problems as a country or a province, we now find what local solutions can we create to bridge the gap. So if some countries have done something before that you think can work, you copy and adapt. If nobody has done it before, you find a solution that works for your country. So it's important that we innovate and test, see what works for us, And we learn by doing, and eventually persons with disabilities will get a better lot. But the final thing is mobilize and update. At the end of all this, it is important that we take necessary action so that these, just like the leader of the Special Olympics had said, it's not just about interest, it's about commitment. So we need to move beyond just interest, but to a point of commitment and to a point where we take necessary action to see that the SDG goal of 2030, where we don't want to leave anyone behind, actually happens for real. We at the Missing Billion Initiative, as I had mentioned, a research think tank, we've produced reports. So some of the data I presented here are available on our website, and you can get them from 3 reports we've published: the 2019 report, the 2022 report, and just a couple of weeks ago, we released a new report which we did in partnership with the McKinsey Health Institute. So these have data and recommendations on how to advance healthcare for persons with disabilities across the world, and I'm sure most of what we recommended are also relevant to people with intellectual disabilities. So on a final note, I would say that we envision a healthcare system for persons with disabilities by 2030, where healthcare is connected and seamlessly coordinated to ensure that anyone with disability has access. There's ease of referral, there's good follow-up, and there's awareness and literacy and early diagnosis. Again, like one of the presentations that we had this morning, early diagnosis of intellectual disability is very important so that we can classify very early people that have very severe intellectual disability or those who have mild so that they can quickly join the educational system, and those who have very special needs, we make the right arrangements for them early enough. The other vision for 2030 for us at the Missing Billion Initiative is to see that we have predictable and affordable healthcare experience for persons with disabilities. In many countries, persons with disabilities are worried about what they are going to do next. If I get sick, I can't access healthcare. And then finally, acceptance for persons with disability. There should be disability inclusion and not segregation of persons with disabilities. So I'll end on a final note and say it's time for action, and I think I'm happy that this event is happening and implore all of us to take the necessary action to improve access to healthcare for persons with disabilities. Thank you very much.
Thank you very much. Je pense que vous avez un peu la quintessence de ce qui a été dit à travers ces éléments de rapport de 1 billion. Donc, il parle du principe qu'il y a à peu près 1 milliard de personnes qui ont des déficiences et que ces déficiences sont associées également à un problème d'accès aux soins et qu'il va être une priorité. Et ces populations, comme il l'a dit, sont plus exposées à des morbidités telles que le diabète, le VIH, etc., qui sont des causes de mortalité. Et il rappelle que pratiquement ceux qui ont des déficiences ont pratiquement 10 à 20 ans de moins d'espérance de vie que les populations qui n'ont pas de déficience. Et qu'il faudrait faire quelque chose. Et ces problèmes sont entretenus par la pauvreté, en fait, le statut de réfugié, ou bien même chez la femme. Je pense qu'on parle beaucoup d'approchage, c'est extrêmement important parce que la population féminine est souvent exposée à ces problèmes. Et qu'il faudrait avoir une stratégie qui soit multisectorielle, qui s'appuie sur une bonne gouvernance, un leadership affirmé, des financements conséquents, mais également d'avoir une disponibilité de données qui permet de faire une planification. Je pense que c'est extrêmement important. Il a parlé d'autres priorités qui sont l'innovation, donc mesurer pour améliorer, etc., mobiliser, informer pour influencer, etc. Je pense qu'on a eu droit à une très bonne conférence qui est très informative et qui nous permet un peu d'avoir une base pour nos discussions qui vont venir par la suite. Merci beaucoup. Thank you.